All right. Welcome to Clear Vision Wednesday. We had some technical issues right now, but now we are live. So happy to be here. I am Claudia Mühlenweg. I am the founder of the Natural Clear Vision Method, actually the Natural Clear Vision Institute. And every week we go live here and share important information about eyesight improvement, vision improvement, about eye health. And today we have a special guest that I'm very excited about. We have on, I'm going to bring her on in a second, Dr. Monisha Bhanote. She is a quintuple board certified pathologist and an integrative medicine specialist. And we're going to talk about eyelid diseases from inflammatory things like styes, chalazions, Meibomian Gland Dysfunction, those kind of things, as well as what she told me is called neoplasms, tumors. So we will show some slides today, just FYI, before you start watching. We will show some slides and some images might look a little graphic. We just want to let you know in advance, but we're not going to start with the slides right away. So let me bring her on. Welcome, Monisha. We just highlight your video. Okay.
Hi, how
Hi,
are
hi.
you, Claudia?
Hi. Quick thing, my team, can you please make me host again? I cannot highlight myself again. So we are super happy to have you. So tell us a little bit about your background. Like, how did you end up doing all this and how did you get from, traditional medicine pathology into integrative medicine?
Yeah, absolutely. Great question. Thank you so much, Claudia, first of all, for having me on this show. I'm really excited to talk to your community and talk pathology because a lot of people don't even know what pathology is. And I think it's really important to educate people on their body. So how did my journey start? Well, so I am a conventionally trained medical doctor. I am an MD. And as an MD, my thought was that, all right, I'm going to become a doctor and I'm going to go in the hospital, I'm going to go in the clinic, and I'm going to take care of patients, which I did. Okay. But that was a couple decades ago. And while that was happening, I'm like, why isn't anybody getting better? Like that was my biggest struggle was like, I'm doing all this work, I'm giving them all these answers, I'm giving them all these drugs, and why isn't anybody getting better? So with that was a very short-lived but eye-opening experience doing internal medicine. And from there, I was like, I need to really think about what am I going to do in my career. And I'm a very visual person. Like I can see things and rearrange them in my head, visual spatial. I can identify, like I'm literally one of those people who can pick a pin out of a haystack. Like I can see all those details, or a branch in a forest, or if you lost your phone in the forest, I can find it. So with that, pathology is really the study of the disease process of the body. So we have, and it's analyzed through anything that comes out of the body. So whether that is body fluids like your blood tests, your urine tests, some fluids you might not want, like ascites fluid and pleural fluids, those kinds of body fluids. We're also analyzing all the tissues. So now imagine you're going for a colonoscopy, or you're going for a skin biopsy, or you're going for your breast biopsy. Those end up on the pathologist table. And then I further did my career in cytopathology, which is looking at single cells and diagnosing disease. So going from this macrocosmic place down to the single cell. So when I'm talking about things, I'm always talking about, all right, this is a structure of this cell, and we have all these different specialized cells, but how can we keep them healthy? And that's kind of how our conversation is going to go today, because many people don't realize that everything they do impacts their cellular function. And so with that, I trained in anatomic and clinical pathology at NYU Winthrop. I trained at Cornell in the Upper East Side in cytopathology. And I also trained at the University of Rochester in breast, bone, and soft tissue cancers. So a lot of pathology training, but what I realized after just diagnosing so many diseases, benign and malignant, that I almost have this like secret message that nobody's talking about. And that's where I went in and I'm like, all right, how do I take my interest in really healing people and combining my expertise in pathology? And that's where the training in integrative medicine came from, right? Because the conventional training that I was exposed to, which was, in my view at that time, a couple decades ago, was more of a drug dealer rather than a lifestyle or a nutrition dealer. So right now I'm a fruit and veggie dealer, if anything. So with that, I started going, what are the aspects? Because as a pathologist, I know the etiology or the origin of these pathologies or diseases, right? So if some of them are preventable, and a lot of them are, because just giving you a number here, 95% of cancers are not genetics, right? So if they're not genetics, then what is it? It's lifestyle. And lifestyle is anything, from environmental to what we can't control to what we can control. So this is I would say, a global problem. So that led me down that path. And that brings me to what I kind of do today, which is really take more of that's really the brief story of it. But what I do today of really taking a holistic approach to looking at how the human body works and putting my patients or putting the people I work through med school on their unique body in 6 months.
Awesome. So thank you for giving us that overview. And that's exactly why I have you on here, because you understand all these from a like cellular level, all these diseases are, and like you said, this is actually, I didn't know this, 95% is lifestyle related. So guys listening, this is a good thing, I think, because it's in our power. I mean, and you said some things are not in our power, but we have to, environmental, now we're all exposed to all these plastics. I mean, there is a thing that we can't control, but we can control a lot. So why don't we kind of, I think we want to cover different things. We talked about inflammatory eyelid diseases, the neoplasms, the tumors, and then also cosmetics. What is maybe cosmetic related? So I know you brought images, so that I think I'm like you, I'm very visual. So do you want to start sharing? And again, remember, if you don't want to see them, you can close your eyes. If you're just listening, that's fine. But should we start with those inflammatory, the ones that everybody probably has maybe experienced? I actually never had a stye in my life, but those kind of things. Start with those.
Yeah, absolutely. Yeah, let's start with some images, and I'll give you a little bit of warning if you're just listening to this, great. If you're listening to it on like a podcast or wherever you might be listening to it, definitely come back and watch the video. But if you're on live with us on YouTube and you just want to turn your head, just turn your head, but keep listening, because this is something that we are all exposed to and could potentially have throughout our lifetime. So this is, from teens up to older age, that it applies to everybody. So let me do a screen share here.
And like she said, if there's something that might be a little bit more scary looking, we're gonna give a warning ahead of time. So, okay.
Can you give me a thumbs up, Claudia? Because I got all these monitors going.
Yeah, it looks great. We see your screen.
Okay, perfect. So today, our talk is really on healthy eyes, healthy eyelids, and just to orient you, we are gonna talk first. It's really important for me to have you understand the anatomy of the eyelid. And then based off of the anatomy of the eyelid, we are going to talk about inflammatory conditions, as well as a few neoplasms. Neoplasms are cancers. Neoplasms can be benign and they can be malignant, okay? So neoplasms is just a general category. And then because of the increase, actually this kind of has happened even more since the 2020 situation we don't talk about anymore. But if you recall, all we were really showing at that time was our eyes, right? And during that time, there was actually an increase of people having cosmetic surgeries on their eyes, because that's the feature that they could show the most, right? Because the rest of their face is covered. So I do want to talk to you about some of the complications of surgeries and cosmetic procedures, and if you are doing them, how to better take care of yourself with them. So with that, I'm always thinking about the anatomy. And when, Claudia invited me to speak on her vision podcast here, I was like, there's so much we can talk about, because from an anatomical perspective, we have the eyeball, we have the eyelid, we have the orbital space, we have the optic. There's like literally a ton of diseases we could talk about. So we did land on the eyelid because we've all got eyelids. So I thought, let's do that. So the area we are going to focus on today is specifically the upper eyelid and the lower eyelid. So when I'm talking about entities and diseases, we are basically just focusing on the eyelid. Now, there are other things going on that could happen here. We're not going to delve into the lacrimal gland, which is responsible for helping make your tears and stuff like that. We're not going to go in that direction, but just to keep in mind that we're quite focused, and this is really where pathology becomes interesting, because when somebody talks to me about, oh yeah, I have this cancer or I have that cancer, especially like, let me give you an example. 1 in 8 women has breast cancer. And I ask them, oh, what kind of breast cancer do you have? And they're like, just breast cancer. And I'm like, no, there's 30 different types. Tell me what you have so I can like think about it, So there is a lot more that people don't realize when pathologists, who are actually the doctor's doctor, like we're the ones with the answers, so that other doctors, the clinicians, can go and treat. So we hold the answers, so my colleagues can go prescribe or do surgery or whatever they need to do. So with that, here is the anatomy of the eyelid. And now this is what we call a cross section of the upper eyelid. So now if you imagine you take your little upper eyelid and it's excised out, and it's goes through a pathology process, which basically requires us to, and I didn't include that image in here, I really should have, which it's a certain process that happens that allows us to then take that tissue and make 3-micron thin sections and place it on a glass slide so we can visualize what is going on. And so you can imagine this is 3 microns thin, like it's like thinner than tissue paper, and it gets put on a slide. And no, our tissues are not purple and pink, and they're also not black and white.
I was just saying, the left one looks like a slice of bacon or something.
Yeah, so the reason you're seeing these colors, this just simply is a black and white image on the right, but the reason you're seeing purple and pink is, and some white here, the purple and pink is a hematoxylin eosin stain that we use in order to see cellular structures, nuclear features, and evaluate the tissue. Okay. But and for the most part, both of these are the same. So from when we're looking at it from an anatomical process, certain conditions of the eyelid arise from certain parts of the anatomy. And that's why I wanted to make sure you understood that, because there's a difference between, if you get something like a adnexal gland lesion versus a sebaceous gland lesion. Like, they're all arising from specialized cells. That's what kind of makes it super cool. So if we orient ourselves to this one on the left, because frankly, I just find pink and purple a lot prettier to look at than black and white. If we orient ourselves to that, this top part here, this darker purple part, if you can see that, is the outside surface of your eyelid. Okay, so that's the epidermal side, right? So that's the cutaneous side. So this is kind of what regular skin would look like. It's an epidermis.
If we apply eyeshadow, it would be on that piece of the eyelid.
Exactly. Correct. So our eyeshadow should go there. Yeah, since we are going to be talking about makeup and stuff. So absolutely. So our eyeshadow would go here. Now this underlying side of this is known as the tarsal plate. Okay, so the tarsal plate is what, when like that inner side, if you flip your eyelid over, is kind of like this smooth, shiny part, right? So it's a conjunctival side. So it's the side that's like facing the eyeball there. Completely different and different tissues. And now you can see them morphologically that they look like different tissues, right? So this one, and this isn't a high power view, this is a low power view, but they're different looking. Then the other part of it, you might be going, well, what are all these little circles and dots and all this stuff in here? Well, this is your muscle. So this is the muscle that helps you raise and close your eyelid, right? So as we age, this is like when I think, people start getting eyelid lifts and stuff like that because they're not taking care of their eyelid health, right? Who thought like, oh, we need to take care of our eyelids. We need to take care of every single
My eyelids. Yeah.
we need to take care of every single cell in the body. and that's why, health conditions like I want people to realize that when you're dealing with a health condition, like say you are dealing with an autoimmune disease and you take a steroid for that autoimmune disease and you think, oh, I'm getting better, but then you don't realize the steroids are going to affect your eye health in the future. Everything is connected to each other. So every action we take, good or bad, influences how our cells function. Then the other thing I want to talk to you about here, because this is the cool part, because when we go into the inflammatory lesions, where is the difference? Is the glandular structures here. So there's 3 different types of glands that we have in the eyelid. So we have something called Meibomian glands, okay? And people definitely have issues with those when they're maybe experiencing dry eyes and stuff like that, because what do these Meibomian glands do? And the Meibomian glands are over here. Okay, so they're a sebaceous type of gland. Okay, so like I said, sebaceous glands, when you think of those, think of like lipid producing, right? So we have like sebaceous glands on your skin as well, like, so they might make your skin more oily. Same thing in our eyelids, right? So they're meant to create some chemical, some lipid stuff to kind of moisturize our eyelid. So when that gets damaged, and I'll tell you why that gets damaged, when that gets damaged, we run the risk of having dry eye. Isn't that interesting, right? So it's like these specific glands here that are being influenced, right? What can cause this, this specific gland, the Meibomian glands, to be damaged is obviously poor hygiene, right? If we're not washing our face properly, if we're not cleaning our eye makeup off, if we're sleeping with our eye makeup on, things like that. Bad nutrition can also influence this, right? So if you are eating a highly processed, fatty diet, it's not good for your eyelids. Okay, so I mean, who would have thought it would be, that could go that far and influence your eyelids. And then one of the things we have seen in, I would say, the last decade or so that has really been influencing these glands is technology. And the reason I say technology is because when you are on the computer, on your cell phone, on all these devices, and you're constantly staring at a screen, right? You're not blinking as much, right? So your blink rate decreases, and now these glands aren't doing what they need to do, and they get clogged. And when the glands get clogged up, and I think people can imagine clogged glands because they can think of them like in other parts of their body, like if they get acne and stuff, like that's a clogged gland, right? That's another sebaceous gland. But the same thing happens in our eyelids. And wearing makeup such as, mascara, eyeliner, when you put it on that inner side, all of that, right? Because this is like what do we call that? We call that it's a specific line name for that. It's like where you put the eyeliner on that inner.
Right, I know. Is it called Kohl or Kajal or something? I don't know, but I know.
So there's I can't remember right now, but
Right.
But then the other thing to keep in mind is that things that will mess with these glands are your medications, right?
Mm.
So certain medications like acne medications, psychiatric medications, so that overdosing of Prozac and all these other psychiatric medications that we're taking, they can influence this as well. So that's just that one gland. And then, so let me move, and then we'll go into the different inflammatory diseases that we're going to see there. One of the big ones, and this is not even a medication because people are getting this over the counter, this treatment, is retinol, right? So now imagine you are putting retinol, a source of vitamin A, on your skin to address wrinkles, right? And that's why if you actually know how to put on eye creams and where to put them, you don't actually go very close to your eyelids. There's a reason for that. Because although retinol is great for that wrinkle effect, studies have found that retinol alters the function of these meibomian glands, okay? And it alters the function down to the gene expression level.
Wow, so that's a good tip. So no eye makeup close, no retinol creams close to the eyelids. Okay, all right.
Yes. Yeah, so definitely we don't want to, so when you're putting your eye cream or your retinol creams, like keep them lower down, right? You don't want, because things do migrate up that way, right? Because they can destroy these glands here. And when they destroy them, now we've got dry eye.
Right, which is so common as we get older with hormonal changes and like you said,
Absolutely. Hormonal changes also, right? And then the next set of glands is the glands of Zeiss. So these are over here, and these are just, these are the ones that are in the middle portion near the hair follicles. You can see these little holes here. These are empty hair follicles right now. And these are the types of glands that when we have a chalazion that I'm going to show you, a chalazion is an outer nodule. When we have those are the ones that get involved in there. And
okay.
yeah. And then the last set of glands is your apocrine style glands. And those aren't so obvious in the picture on the left, but they are on the right. And apocrine glands are your sweat glands for your eyelid. So you even have specialized sweat glands for your eyelid, and they're called the glands of Moll, right? So I don't know who named all these things, but they're a specialized one. And those glands can actually be protective because they're believed to have like a antibacterial lytic like an enzyme that they produce to kind of help protect the body. So it's a localized immune defense. And I guess you can kind of see it a little bit better here where you have the glands of Moll here. At this top is your sebaceous version of your Zeiss glands. And then over here, this whole thing is your Meibomian glands.
Meibomian glands, yeah.
Right? So that's essentially just anatomy. So let's run through 3 conditions, okay? So now I am going to show you some images of some eyes, okay? But I'm also going to show you the pathology that goes around with that condition. So if you kind of get grossed out by looking at, well, it's just basically the human face, you might not want to look at this image. But so the first one I want to talk to you about is blepharitis, okay? Anything that usually ends in the word itis is basically the inflammation of, okay? So all blepharitis means is the inflammation of the eyelid. So, colitis, inflammation of the colon, gastritis, inflammation of the stomach. So that's all itis means, is inflammation of. And generally, this is not biopsied, but I was able to find a sampling of this. And all it is, remember I told you the surface skin of the eyelid, it's just skin. It's very thin skin. You can see this layer. All it does is it gets infiltrated by inflammatory cells, right? So it's basically an inflammation of the eyelids. And how might you know you have this? Well, and it's different than pink eye, right? Because that's conjunctivitis, that's inside. This is on the outside that we're talking about. People who have this kind of have like, crusty, scaly eyelids. Maybe you wake up and your eyelids are kind of stuck together and obviously they get red looking. We don't really know what the cause of this is, but there's certain conditions that it's more associated with. So if you're an individual who has allergies, you're more likely to be exposed to this. If you're an individual who actually has rosacea, right? So when you're dealing with facial rosacea, you're also dealing with eyelid rosacea, right? And then individuals who have a specific type of dermatitis can also be exposed to this. And then there's risk factors, right? So you already mentioned hormonal, right? So hormone changes will increase your risk for blepharitis, diabetes, not removing your makeup properly. And then also another one is contact lens wearers.
Oh,
Okay.
interesting. So how come? Because the contacts touch the inner eyelid, right? But this seems to be an infection or inflammation of the outer eyelid.
Yeah, because so you got to remember, if we go back here, right, this tarsal plate that's on the inner and connects back up, and if we're
Right.
not keeping that, which I'll be honest, like when I switched to daily wear contact lenses where you're changing them every day, like eyes so much easier to take care of. I think, when you're using the contact lenses that you wear for 2 weeks and then throw them out, you have to be very diligent about washing your hands, washing the contact lenses, especially when you're wearing eye makeup, if it falls in there and drops in there.
Right. That makes sense.
Right? Because now we're bringing bacteria from the outside in.
Right. How do you treat, like, what would be your recommendation to, like, for people, because we have a lot to cover. Your recommendation for blepharitis? What can people do?
I would say definitely don't touch your eyes.
Right.
You know, try not to touch your eyes. Thoroughly clean your eyes. Use makeup remover. But because now we have a lot of beauty products that are waterproof and that kind of stuff. So you got to use a makeup cleaner that can actually remove that. I love micellar water. I find works very well because it doesn't cause you to like also pull at the eyelids and that kind of stuff, because you can see there's very delicate muscles there.
What oils? There's a question on YouTube right now. What about natural oils like almond oil, jojoba oil, or castor oil, or one of those things?
Yeah, so you can use them. I mean, doing like oil eye drops is okay if you have dry eyes.
No,
Okay,
but I'm
that's
not as,
different than,
of course, as makeup
oh, you
remover.
mean on the outside. So
Yeah, yeah.
here's the thing is you got to remember that if you're putting something on the outside here or you're putting something on the outside here, it will make its way inside. So you do not want to clog those meibomian glands,
Okay.
right? Because it's kind of like when somebody puts like oil on their face or something like that, if they don't know how to use it properly, they'll clog their pores even more, right?
Okay,
So
so hygiene is number one. Okay, got it.
yeah,
Okay.
hygiene is a big one. And then if you have dry eyes, artificial tears, right?
Okay.
Then the next one I want to go over quickly, Chalazion. Okay, we've all had a Chalazion except for you, clearly, Claudia. Okay, I
I don't
remember,
remember ever seeing the bump on my eyes.
that's good for you. So I remember having one when I was probably in high school. I had a Chalazion, okay? And what is a Chalazion other than basically it just means that it generally happens on the upper eyelid, as you can see here. I should flip this picture, but this is the skin surface of that. And then this is what you have there. And this is a lipogranulomatous inflammation. So it's a specific type of inflammation that happens there. Here's a higher power where it's just making these kind of granulomas. And what happens is those glands get blocked and plugged up. And because they're trying so hard to clear themselves out, the inflammatory cells that your body produces goes to them to help them. Okay. But what happens is it makes a nodule there. Now, when that happens superficially, because you can have a superficial chalazion, and that's usually from the Zeiss glands, but if you can also have a deep one, which is from the Meibomian gland. So it's any of the sebaceous glands can cause you to have a chalazion. All right. So once again, etiology is generally unknown, but we tend to see this often when individuals have rosacea, if they're smoking, gastritis, and anxiety, right? So now almost everybody has anxiety. So these are just kind of things that we've seen associated with them. And one of the other things I've noticed is, because I do a lot of testing for vitamin deficiencies. So when vitamin A is severely deficient in individuals, one of their first signs might be a chalazion.
So, and how do you treat? I mean, obviously, we're not giving medical advice, but is this a case where you need to see an eye doctor, or like, I think I want to cover blepharitis? Like, where do you need to go see your eye doctor? Because this looks like a big pimple, and you might be, you might want to be like, oh, let's squeeze this thing out.
Okay,
Probably
so
not a good idea. So,
that's a great question. Any and all of this stuff, like this is the way I see it, is if you have anything on your body that is not supposed to be there, please go see a doctor to then go, okay, this will go away on its own or it won't. Okay. That's one of the things, especially with eyelid disorders. People wait so long that they actually become worse because they think, oh, it's going to go away. Now, chalazions and styes, they are, chalazions themselves are really treated with warm compresses. So this will go down and dissolve on its own. A stye, on the other hand, which is very similar, except a stye is infected. So now you have actual bacteria there that has infected it. And it's really due to a staph infection. So Staphylococcus is the bacteria that goes there and infects it. So that is going to require some antibacterial kind of treatment. So,
and that looks like on the inside. So is this stye always on the inside?
it's they're showing the inside, but it's a bump actually on the outside that goes to the inside because
I see. Okay. Okay.
Yeah, absolutely. So the point is that you definitely, like, anything that doesn't belong on your body, like, and other than, I think most people can identify acne, right? But other than that, you do want to go to your practitioner, whether it's your integrative doctor or your eye doctor. Even the person who's prescribing your glasses and contact lenses should be looking at this stuff.
And how do you know if it's a stye or a chalazion before we move on to the next category? Like, how do you know?
The difference is in the fact that one is infected and the other one isn't. So that's where it comes up to the clinician to look at it.
So because it's red, or just as a lay person without, because
no, because this one can also be red, and it also depends on the person's skin tone and that kind of stuff. The chalazion, when you have that, you'll kind of feel it almost feels like a marble in your eye, like you can move it around. It's kind of like, whereas this one, and this is just from experience of having it, is a little bit more diffuse. It doesn't feel like you have a pea in your eye, like a little marble or pea in your eye. So it kind of becomes more infiltrative in the infection spectrum.
do you have to, does one of them itch, or is there any other signs? But this one, you definitely need a treatment with your doctor, right? With the chalazion, you might need warm compresses, and this one, you have to see a doctor and get some medications, correct? Is that?
Yeah, and the dietary modifications work for these as well, right? So when somebody gets dietary modifications for acne, like avoiding coffee, caffeine, fried foods, same thing applies here because it's the sebaceous glands, right? These glands are getting clogged up. So so they do apply as well.
All right.
Yeah. Do we want to stop there? You want me to keep going with the neoplasms?
We can. I mean, this is definitely a little more scary looking. We just
I see some questions from the audience here about is a bump on the upper waterline. Oh, thank you for the word waterline. What is what I was thinking. A chalazion. No, not necessarily, right? Because that's the waterline. I was talking about the eyelid. So it could be, it could not be. And it could be some of these other things I'm about to show you. So maybe we can show them now, these other
Right,
things.
and on YouTube there was a comment like my chalazions or styes were very sore and took weeks to go away. Nothing helped but time, even using prescribed antibiotics. So I guess just to know what exactly it is, see an eye doctor is definitely a good advice to just make sure. And with the blepharitis, you gave some of the root causes. So addressing those root causes is definitely. But maybe would cooling, like blepharitis, if it's already, would like cooling be helpful? Because chalazion, you said more warm. Okay, so those are some things you can do.
So
Okay,
the
yes.
eyes need rest. The eyes need to be very clean. And clean your makeup brushes and throw out products. That is
Yeah.
one thing I noticed, like don't share your makeup with your roommate or your friend or something like that, because that increases the risk of infections and then getting a stye, right? And I think that's
How often should one, sorry to interrupt, but throw because some of these things are expensive. How often would you throw like a mascara or some of those
6
eyeliner?
months max.
6 months max. Okay, good. Okay. All right, let's move on.
And I'm a makeup person, so I
Right.
like my makeup. Okay, let's get into some
Okay,
of
so
these other ones.
if you're queasy, look away. Otherwise, it's covered.
Yeah. And I'm going to go through this part a little bit quicker because I do want to get to the cosmetic part, because
Yes.
I think that one's really important for people to be educated about before they decide to have some cosmetic procedures. So the next area I want to talk about is we do have neoplasms, like I said, is the general word for mass-like lesions, okay? And now mass-like lesions can be benign or malignant. Malignant is cancer, okay? That's the difference. So what you're seeing here are just 3 different types of cysts that happen inside on the eyelid, right? So the reason we do not ignore these is because the tissue being there for that long can get damaged and scarred. When it's scarred, the eye, like everything doesn't work properly, and it can increase your risk of other things. So that's where I go back to, if you see something, it's better when you get it out smaller and just take care of it than waiting for it to grow. And although I am a holistic physician and I believe our body can naturally heal, sometimes things need to be surgically removed in order for them to heal.
Right.
So this on the left here, this is called an epidermal cyst. So this is just made from that superficial layer of that eyelid, and it's filled with a keratinous junk in it. This one's actually super cool, and we see these all over the body, not just on eyelids. It's called a dermoid cyst. Another place we find dermoid cyst is on ovaries. Sometimes
Yes,
a woman
that's what I had. That's what I had.
Oh, did you? Okay.
I woke out of anesthesia and the doctor said, "You were supposed to be a twin." I'm like, "What?" Like, the Alien movie had just come out and I was like so freaked out. But yeah, so tell us quickly about those.
Yeah. So dermoid cysts, they're benign cysts, and like I said, they can happen on the ovaries, other parts of the body. This one is happening on the eyelid part of it. Now, what's unique about them is that they have all the structures in there. So you have a normal kind of skin structure, epidermis, but then you have the adnexa, but none of this belongs in this person's eye, right? And one of the unique things that we see in dermoid cysts is full-blown teeth.
I know, that's what they told me too. I'm like, it's so great.
Yes. So there's a tooth right there. You can kind of see it in the image. It happens on the ovary too.
Oh my God.
I know. So that is just a lesion that happens. And then the last one is called a apocrine hydrocystoma, another kind of cyst that has a specific apocrine lining on it.
But they're all benign. Are they just
these are all benign, right? So even as scary as they look, benign means that they're not going to go to other parts of the body and become metastatic, right?
Would you
But
say they have to be removed?
they should be removed, right? Because this is going to cause other problems around the eye.
Yeah, okay, got it. Let's look at the other ones. And there's a couple of questions on YouTube. I want to make sure we get to those.
Okay, perfect. So then we're going into the benign neoplasms. This one's still another benign one. And the reason I put this one in here is because next time you're in a room full of people or you're walking down the street, take a look at the people around you. And if you see yellow, like nodules around people's eyelids, those are xanthelasma. And I guarantee they have a problem with their cholesterol. So they're basically lipid-laden or cholesterol nodules that are usually bilaterally on the upper and lower eyelids. And the etiology or cause of this is people who have high cholesterol, people who have very low levels of HDL, which is our good cholesterol. People who have hypothyroidism can also develop this, right? So keeping that in mind, people who have diabetes can develop this. Individuals on certain medications like steroids and estrogens can develop this. And individuals who eat a lot of saturated fat and alcohol can develop this. So, you know, when it comes to eyelid health, it's your lifestyle that's going to impact that as well, right? So when we tell you to eat better, it's really for your overall functionality. So there is no eyeshadow or anything that's going to cover this up when internally you're making it. So that's the important thing to keep in mind here. And so here it is on this woman here. You can see these little yellow plaques, but under the microscope, what it looks like is this. These are lipid-laden kind of plaques here that we see. Now, if you remember that eyelid that I showed you, these weren't there. They don't belong there at all. Right. This also happens in the gallbladder. We call it cholesterolosis in the gallbladder, but we see it in the gallbladder lining as well.
So what is the, obviously cleaning up your like your diet and all those things, but what, like from a, you know, purely vanity standpoint, like what would somebody, because it sounds like they're benign, but what would somebody
from a vanity standpoint, the best way to get rid of those would be to address your cholesterol.
Got it. And then they disappear if you clean up, if you address. Okay, good to know. Yeah. All right, let's look at some other.
So now let's go into okay, we're in between malignant here. Actinic keratosis. The reason I brought this one up is because this also happens all over our body. The individuals who are going into the dermatologist office and getting like, oh, this got zapped, or this got sprayed, or this got cut off. Actinic keratosis is basically your epithelium, and it's become dysplastic or precancerous from ultraviolet exposure, so from sun exposure, right? So if we're not using sunblocks and those kinds of things, that can also happen. And this one is kind of creeping in over to the conjunctiva. But it's associated with the eyelid, right? So when you're thinking about sun protection, wear your sunglasses, wear your hats, because we also have to protect our eyes when we're outside, right? You're not thinking about, like, we're thinking about protecting our eyes because the sun is so bright in us, but at the same time, we're not realizing that it's affecting us at a cellular level. So that is an entity that happened, but the most common one that we see from a cancer perspective is a basal cell carcinoma. Okay, and people get basal cell carcinomas all over the skin, especially individuals with lighter skin are more likely to have them. This covers about 90% of malignant eyelid tumors, okay? And you can see here on the left, this is super subtle. It doesn't even look like a tumor. It just looks like this little like ulceration, like maybe she's been rubbing her eye or something like that. Basal cells tend to be kind of glassy. Like they have this kind of shininess to them. Not like the glass skin we want from Korea, but actually like this like little glassy little nodule thing. And basal cell carcinomas are basically this basal cell that comes off your epidermis, and it has become neoplastic or cancerous and has expanded. So the two, oops, I lost my co-host, but so the two, hopefully she's still there. So the two different types that we see, if you can let me know if she's still there. The two different types we see there are going to be a nodular basal cell and a morpheoform. So morpheoform is going to be this more infiltrative type, which is very difficult to surgically remove. So we want to be very careful if we see anything on our eye. And that's really the reason we go to the eye doctors, or we're going to our doctor, is if knowing it's benign, great, we take care of it. If it's malignant, we need to take care of it more aggressively. And that's kind of the message there to really understand, because you don't know what it is until the doctor evaluates it. And then let's see. The next one I'm showing you is another rarer tumor, but you can have something out of those adnexal glands that are there, and that's called an adenoid cystic carcinoma. And it's quite rare, but it does happen on the eye. And the last one I want to show you is melanocytic lesions. So these two that I'm showing you are congenital. Okay, so this is where, if we are thinking about, you know, we pass on our genes to the next generation. Okay, so this is not just about you taking care of your cells today. This is the next generation, and also helping them. These two tend to develop, like, for example, the one on the left, it's a Spitz nevus. It's kind of called a kissing nevus because it's like it develops on both sides of the upper and lower eyelid. This happens between the 9th and 20th week of gestation. So mama, who has the baby inside her, is making this for this child. It's a congenital lesion, right? And then this one also happens very early on in the developing, and this is this dark thing. These are melanocytes infiltrating through. This is called a nevus of Otta, and it basically looks like she's been punched in the eye, but that's an actual lesion there of melanocytes. The risk of this one is that in the future, she can develop melanoma. So that's really kind of important to know. Also, this is because the cells are not migrating properly in the formation of children. That pre-baby period, during pregnancy period, and post is so vital. I couldn't talk on that more than enough, that, like, you know, what's happening there, because the cells are really coming together and what they're going to do. It's quite fascinating. But okay, the last spot I want to jump on is, and you know what, let's do this case, because we have two cases, but let me give you one case, because they're kind of similar in a way. But so the couple of areas that I wanted to talk about from a cosmetic standpoint was eye makeup, eyelash extensions, and then fillers. But since I'm on the slides, let's talk about fillers first. So this is an individual who had filler put in her peripheral area here. She is, if I remember correctly, she was 62. And she had filler about 8 years ago. So now this is a long time ago. She had filler, and then she went back to her doctors, and she had this little bump, very subtle bump, but she could feel it when she was putting on her face creams. So she went to the doctor, and she's like, all right, what is this? And the doctor then sent her for imaging. And you can see here where this white arrow is pointing. It's this very subtle, soft tissue mass that doesn't belong there. It's not on this side, right? And so when it was excised, and I actually removed the picture of you seeing it pulled back and being excised, but when it was excised, this is what it looked like. This is a cleaned up version of it. It just looked like a little nodule.
Wow.
Right? And so she had this little nodule there, and it's kind of like, okay, what could it be that she had this nodule? Well, when we look at it under the microscope, and here's two pictures on the microscope, you can see this looks like a lot of keratinous kind of debris and some pretty much junk, I would call it in a way. It's a slang word would be junk. A pathologic word would be amorphous material, meaning it's just, we don't know what it is, but we do know exactly what it is. So this was actually polyacrylamide gel filler that she had, which she forgot she had because it was 8 years ago. So she didn't even think that that had migrated when she had gotten her cheeks lifted, that it had migrated up and caused this nodule. Right. And the body did not like that nodule because it's also producing something we call Teuton giant cells, which are a type of inflammatory response cell to kind of surround it and block it off so it doesn't go and infect or bother the other tissues. So this actually is the when people are using this specific type of filler, the polyacrylamide, it is non-biodegradable, which means that that gel won't really degrade. So it can move around. And interestingly enough, I don't know if you've noticed that on social media, I've been seeing a lot of celebrities who had fillers actually going and getting their fillers dissolved, their cosmetic fillers, because these things are causing problems now. And I think the important thing and the important lesson to know here is that anything and everything you do has a downstream effect or upstream effect, right? So make sure you're asking the questions that you don't know how your body is going to react to something. To me, I see this as a foreign body giant cell reaction. So be educated before you're doing something is where they're kind of doing the lesson is in this.
That is so fascinating. And I think we have a bunch of questions on YouTube, but overall, like my question would be like the basal cell. I had one, on my skin on my arm, and that was, surgically removed. But what about that one that was right on the eye. Like what would people have to go get surgery on that one? That's kind of
absolutely. Basal cells
right.
need to be removed. And the two that I showed you a nodular and a morphiform. Nodular is it can be pretty nicely excised. Usually it's a specialized surgeon. It's called a Mohs surgeon that does that because they go through and they make sure they get all clean margins while you're still there for the surgery. They go and they check that because what basal cell likes to do is it likes to have like finger-like projections. So getting a clear margin for a basal cell. This is not something you go to your regular doctor and be like, oh, can you
Right.
do this? No,
Yeah.
no.
Yeah.
No, please no. You want to go to a Mohs surgeon for this. So it gets removed the first time because with any surgery, if you need to get something out, you want to get it out the first time.
So Emma on YouTube is asking, she had a chalazion for years now, and it's still there. Is surgery then the only treatment? Like, what could she do in that case? If it's like after years and years, it's still there.
I would question if it's a chalazion first. So, because maybe you were told by a doctor it was a chalazion, and if it hasn't dissolved in that long, perhaps it's something else. You can have it surgically excised because it could be so scarred off that it's not able to dissolve on its own now with like compresses and that kind of stuff, that you can go get a little, like a baby surgical incision so they can kind of just scoop it out.
Right. And there's some other questions about corneal abrasions, but I think we want to have you back for that because that's not our topic today. But that was great. Let's wrap it up. So we can always bring you back because that was so informative. So how do you, I know you're not an eye doctor, obviously, but how do you help people? Where can people find you if they want to learn more about what you do? We put all the links under the show notes, but just maybe briefly tell us a little bit about how people can work with you.
Yeah, absolutely. So yes, I am not an eye doctor, but I am a doctor. I am an MD. You can find me at drbhanote.com. That is my website. All my social media platforms from Instagram, Facebook, YouTube, LinkedIn, everything is Dr. Bhanote, easy enough to find. And I think from a perspective of working with me, there's a few avenues. I do see patients in the 5 states that I'm licensed. I have a telehealth clinic, and I work with them virtually really to restore their cellular health. You know, I have a Cell Revive program, and this is really kind of taking a big picture view and going, all right, this is where we need to start at that cellular level to start fixing all these kind of health conditions. And then I also do in-person retreats, which I love to do because just really getting into that space where you're able to start healing your body on that deeper level. And then you can also find out more information. I have my book here, The Anatomy of Well-Being, if you love talking about anatomy, but also want to translate that anatomy into your lifestyle. That is the avenue to go. And yeah. And yeah, I would love to come back. Like I'm still like fixated on this because I feel like my eyes are a good feature for me. So I wear a lot of eye makeup. So I love talking about how, you know, really taking your eye makeup off is so important. And in fact, they showed, I'm trying to remember if this was a 2022 study or earlier, no, maybe later, around that time, there was a study where they took individuals who wear eye makeup and don't wear eye makeup, and whether they wear eyeliner and mascara, eyeliner alone, mascara alone, or eyeliner and mascara. And they found that the individuals who wore eye makeup actually had less of those glands, the Meibomian glands, right? So it actually increases your risk to develop dry eye later, right? So I'm not telling you to stop wearing eye makeup. I'm just saying decide when you're going to wear it. And the other thing is I really don't want to see our 10 and 12-year-olds wearing eye makeup.
Yeah, and I think, thank you so much for that. And I think to add to what you said in the beginning about the cell health, right? It all starts with the cellular health, and it really starts with our lifestyle. And, you know, obviously, you know, I'm in my 60s, you know, I did bad things in my past, but it's never too late to make changes. And I think you have a free recipe book. We linked that on YouTube. Really starting to address, like, you know, what you talk about, the cholesterol, the diabetes, the autoimmune diseases, and really working from the ground up on your cellular health, because that will then be reflective of all the things. And then, yes, see your eye doctor. I had a really scary thing that was not an eyelid thing, but my sclera, my right part of my left eye, was all of a sudden totally bloodshot red. And I have an eye doctor friend, so I'm like, okay, what is this? He said, oh, I forgot what it was, but some hemorrhaging, and it's going to go away on its own, and it did. So I got it checked out and made sure, but it was like, it didn't look very good for like 2 months. And then it's completely gone. But it was like overnight. I'm like, it's not like I bumped my head or I did like 2 hours of handstands, or like no idea where that came from. And so I think it's important that we do get our eyes, that we get it checked and make sure that's nothing dangerous. Those basal cells, like I had one of those on my arms. It just doesn't even look like, you know, the dark ones where you're like, that's probably something really bad. You go to the dermatologist. No, that's fine. And then the other
Basal looks
thing,
like nothing. It's just like
right?
this little shiny little thing. It's so cute. And I'm like, no, that's not
Yeah, I
cute.
used to have those, what is it called, psoriasis, and sometimes it looks like a little like,
Mm-hmm.
anyway, so make sure you get those things checked. So thank you so much,
Take
Dr.
care of yourselves, humans. We
Yes,
will, we
and
only got 37 trillion to take care of, but take care of them.
well, that's a cute little thing. And yeah, download her free recipe book, or get her book and follow her on Instagram. You're doing amazing information education. We are really grateful for you. So thank you. Goodbye.
Thank